Hello, my name is Eleanor Fox. I'm here with my son who's going to help me with my head, eyes, ears, nose, and throat examination. Um, Once again, I'm going to get consent before we start. I want to let you know that the video will only be viewed by my instructor for grading purposes only. It won't be broadcasted or made available to anyone else. Do I have your consent? Is that okay if we record?
Yes, that's fine.
Okay. We'll now begin my HEENT exam for MSN 572. I'll begin by inspection of the head. Inspection of the head involves first an inspection or just visualizing, looking at the head for contouring, any signs of trauma, any abnormalities such as depressions or concaveness or surgical scars. As you can see, his head is perfectly round. I'm gonna next touch. I don't feel any signs of abnormality. It's smooth and round all over. I'm gonna look at the scalp. When I look at the scalp, I'm looking for dryness. I'm also going to, in a clinical setting, wear gloves because I'll be looking for any signs of lice, bugs, or anything that may be hiding in hair. While I'm touching his head, I'm also taking note of the texture of his hair. It's normal for ethnicity. It is not dry. It's not brittle. Some things will be indicative of thyroid problems. It's not dry. There's no shedding. There's no alopecia. It's evenly dispersed, and everything looks healthy and normal. I'll also visualize his eyebrows while I'm here. They're symmetric. They're in the right place, and to touch, they're soft. There's no shedding, there's no bugs or any pests in there. And the eyelashes, they're present, they're growing in the appropriate position, out and up, top and bottom bilaterally. The mustache is intact and he's groomed the hair from his chin. There doesn't seem to be any alopecia or missing spots in that area either. I'll also note that his skin is normal for ethnicity, brown in tone, no yellowing or any signs of jaundice so far of the skin. I'll move on to assessing cranial nerve 1, the optic nerve. I don't quite have 6 feet of space to move, but I'll do the best that I can. 6 feet away. My small Snelling chart, if I had the large one, it would be 20 feet away, probably mounted on the wall. And I'm going to ask you to cover your right eye, and I'll ask you to read the smallest line that you can visualize.
THJBS.
Okay, now I'll ask you to cover your left eye and read the smallest line that you can visualize.
DHJBS.
Okay, now I'll ask you to uncover both eyes, and I'll ask you to read the smallest line that you can visualize.
DHJBS.
Okay. DJSBS puts you at 20/40 for your visual acuity. Next, I will get my ophthalmoscope. Turn it on. The first test that I'll do, I'm assessing the eyes. I'm going to test for conversion and accommodation. As I move the ophthalmoscope closer to your face, I want you to follow it with your eyes. And what I expect is as I move the ophthalmoscope closer to the midline his face, his eyes should go in and down to visualize the ophthalmoscope. And the pupils should constrict. As I move the ophthalmoscope away from his face, I expect that's called convergence. As I move the ophthalmoscope away from his face, I expect acclimation, meaning his eyes should move back to the lateral position and the pupils should dilate. Very good. So next I'm going to test for a few cranial nerve, your extraocular movement. I'm going to begin with cranial nerve 4. 4 is trochlear. I want you to follow the ophthalmoscope. Trochlear eye movement, or cranial nerve 4, assesses lateral movements. Very well. I'm going to assess for cranial nerve 6, which is abducens, which assesses for extraocular movements that are down and medial. Down medial right, down medial left. Cranial nerve 3 assesses for oculomotor movements, all the other movements excluding lateral and medial down. So I'll first start by assessing up and left, and then up and right, down and up and not medial, but I'm so sorry, or more lateral on the left, and down and lateral on the right. Very well. Next, I'll inspect the inner portions of the eye. I won't need my ophthalmoscope for this. I'm going to take note of your eyelids. They are not droopy. They, as I stated before, the eyelashes are anatomically correct, meaning that they are growing out and not in, and the borders of the eye are appropriate. They're not hyperextended or lagging. The eyes are straight. There's no extraocular movement during the vertical and horizontal portion of his eye exam. He was negative for nystagmus, which would have been a tick of the eyes when he was going lateral or horizontal. I'm going to inspect, I'm going to touch. The conjunctiva are pink and moist. The lacrimal glands, and can you relax a little bit? The lacrimal glands and sac they don't show any signs of being clogged, no swelling. The sclera are enteric. They are not yellow, showing any, meaning they're not yellow or showing any signs of jaundice. Both pupils are dark brown, round, crisp edges, and symmetric in size. The pupils are equal. And I'm going to ask you to cover your right eye as I assist to see your pupil reaction to light. I'm going to use direct, and the pupil should, I need you to look up, like up, yeah, thank you. Okay, you can cover this one. The pupil for direct eye light the constriction occurred in the eye of direct vision or visual of the light, as it should. Now I'm going to check for consensual. When I shine light into the right eye, the left eye should constrict. I want you to look up and straight so that I can see what happens over here. Both eye pupils should constrict. I'm going to do the same for this eye. Very good. I'm also taking note of the color of the sclera. I've already said the sclera. The cornea. The cornea is clear. It does not have any cloudiness. It will be indicative of glaucoma or cataracts. And no scarring that I can visualize. It's clear and shiny and intact. The eyeballs, as I look at them from the side, there's no signs of bulging or injury or any abnormalities, no swelling. I'm going to go ahead and palpate the sinuses, the frontal sinuses. Any tenderness? As well as the maxillary sinuses. Any tenderness?
No.
Okay. And I think that's it for that portion. Now I'll take a look at the inner portions of the eye. I'm going to stand back. I'm going to ask you to look straight ahead so that I can have a visual of your pupil, because I'm looking for what we call a red reflex. The absence of a red reflex, you're much teacher probably thinks I'm crazy. So I'm sorry. Okay. 0. Okay. All right. I want you to open your eyes a little bit wider. Dimming the lights. I started off with them a little dim because I didn't want to step out of the picture to adjust. Okay, I got your red reflex. I'm gonna move in since I have it, and I'm gonna touch your forehead for safety. this is going to allow me to visualize it, the inner portions of the eye. Mm. Mm. Okay. Hold it up a little bit. Okay. I'm visualizing the disc. If I can just, and cup. The cup to disc ratio is 1:3. The disc is crisp with sharp edges. It's orange in appearance, orangey. The cup is a little bit I guess orange or yellow. Could just hold still, please. The arteries, the arteries are, let's see. Look healthy. The veins are a little bit harder to see because they're darker. The arteries are, well, the arteries are the smaller ones but brighter, and the veins are the larger but darker. There's no cloudiness. I don't see any vessels that appear to have any hemorrhaging or anything indicative to no plaques from what I can see. I'm going to now do the same thing with the right eye. You have to hold them up and open so that I can find my red. Okay, I got it. I keep them open so that I can trace it. Open, open, open. Put my hand here for safety. Okay. Cup to disc ratio, 1:3. Disc crisp, sharp edges, round. And same as in other eye. The vessels are no signs of clotting, bruising. I mean, not bruising, but plaques or anything abnormal that I can visualize. So, normal and healthy. Next, I'm going to go on to my otoscope to visualize your ears, or to assess ears. Before I look inside, I'll inspect. I'm going to touch your ears. I'm going to pull up and back on your orbital, your lobal, and let me know your tragus. Same on the other side, up and back. I'm going to palpate your tragus, pull down on your lobal, and I'm going to palpate here for tenderness. These are all areas that will be tender if you had any irritation, inflammation, or possible infection in the inner ear. Everything seems normal, no pain, no discomfort.
Everything's normal.
Okay, so I'll turn on my otoscope. I'm gonna pull your ear in up and back with my left hand. I'm gonna extend my fingers. I'm gonna wrap my fingers around my otoscope securely, and I'm gonna extend these fingers to brace my hand against your neck to prevent me from entering too far into your ear for safety measures. The ear canal is normal, no signs of trauma or redness, no excessive rumen or earwax. Everything looks normal within the canal. So I'll pull the ear up and back and visualize the inner portion. Tympanic membrane is shiny gray. The arm of the malleus is visible. The umbo. The tympanic membrane is intact. There's a little bit of earwax in here, but I can visualize it. And the tympanic membrane is intact. No punctures, no swelling, no and flat and shiny, no bulging, and the cone of light is at 7 o'clock, and this is the left ear. It's okay. That's appropriate. I'll move to the right ear. I've already tested it for tenderness. I'm gonna pull it up and back as the other. Put my fingers here for safety as I look in. Sorry, I'm sorry. Finger. Finger is okay. Tympanic membrane, shiny, gray. No punctures. Let's see, let me find my cone of light. Cone of light. Okay. Cone of light is 5 o'clock. Can see a portion of the malice and the umba. This ear needs to be cleaned out. But other than that, you're fine. You don't have any issues.
No issues.
Okay. Now I'm going to check optic nerve, your acoustics or hearing acuity. This is for lateral loss of hearing or lack thereof, and it's called the Weber test. Tell me when you can, whether you can hear it the same on both sides, more on one side or more on the other side.
Here at the sign.
On both sides.
Yes, on both.
The next test I'm going to perform is a test for conduction. The results I expect to find is that that air conduction is greater than bone conduction. So I'm going to tap my malice. I'm going to put it on your mastoid bone and tell me when. Tell me when the vibration stops.
No.
Can you hear?
Yes, I can still hear.
Can you still hear it?
I'm listening.
No.
Okay.
Same on this side.
No.
Can you still hear it?
Yes, I can still hear.
Tell me when it stops.
Stop.
Okay, your test is good. You had the results that are expected. Bone density will pick up on the vibrations of the bone, and the air conduction, which meant that when there was no longer any vibration that you could feel on your mastoid bone, you still could hear the ringing of the tuning fork in your ear, which makes air conduction greater than bone conduction. Next, I'm going to perform what we call a whisper test. I don't know if I said this before, but this is cranial nerve 8. Testing for acuity of hearing. I'm going to stand approximately 2 feet behind you, and I'm going to ask you to close your left ear, and I'm going to whisper, and I want you to tell me what I'm whispering. 3 feet. Okay, repeat what I've said.
3B2.
Now I want you to cover your right ear. I'm going to stand 2 feet away, about an arm's length. And I'm going to whisper again. I want you to repeat what I've whispered. Okay, repeat it.
B13.
Very well. Now I'm going to move on down to the nose. I'm going to look at your nose for symmetry. Everything seems to be the ridges appropriately aligned and symmetric. I'm going to look on the inside to inspect the septum. The septum is intact. No holes or anything else. The mucosa is pink and moist. And the mid-turbulence is pink and moist. A slight bit more pale than the nasal, anterior portion of the nasal passage. Both sides are open, free of edema or arrhythmia. No signs of trauma. Septum straight and intact throughout. No abnormalities that I can see. And I'm going to check I want you to close your eyes, and then I want you to close your right nair. And I want you to, I'm gonna let you smell something with your left nair, and I want you to tell me what you're smelling.
Coffee.
Okay, very good. Okay, again.
Alcohol.
Okay, keep your eyes closed. Now I want you to close your left nair. And I want you to tell me what you smell.
Alcohol.
Tell me what you smell.
Coffee.
Very well. Okay. The next thing that I'm going to do is inspect your mouth. I'm so sorry. First, I'm just going to take a general overview. I'm going to note that your lips are free of chafing or lesions, trauma. I don't see anything that would indicate surgery. The color is normal for your ethnicity. And I'm going to ask you to show me your teeth. See your gums. No signs of swelling or bleeding to the gums. I want you to open your mouth so I can look at the inside of your jaw, which we call buccal. I'm looking at your teeth. They are all intact. I don't see any dental caries. The roof of the mouth has no lesions or papules or anything that's abnormal. The buccal, no chewing or gnawing, no sores. I'm gonna look along the gum line. Don't be so. If I had the tongue depressed, I would look still the same. Nothing abnormal. I'm looking in the back where I can see the tonsils. I would grade them as a 1. They look pretty good. I want you to say ah. Okay. I'm assessing cranial nerves 9 and 10. The glossopharyngeal and vagus nerve. The palate is soft. The uvula is medial, midline. The pharynx moves medial as it should when he says ah. There's no redness, no spots or like white spots or any swelling in the back. You don't have any sore throats or anything like that. I want you to lick your tongue out. I want you to move it from left to right. I'm testing cranial nerve, and I want you to use your tongue to poke out both sides of your jaw. Cranial nerve 12, the hypoglossal cranial nerve for strength, and the tongue being midline. Those are all good. I'm going to assess the lymph nodes. In front of the ear, preocular, behind the ear at the mastoid process, posterior ocular, at the base of the skull, occipital, along the trapezius, posterior cervical, tonsillar at the angle of the mandible, submandibular along the angle of the mandible, and about 2 centimeters back medial the mandible, the mental, along the sternocleidomastoid, the anterior lymph nodes. And I'm going to test, I'm going to ask you to do a shoulder shrug, up, down, trapezius. I'm going to ask you during this exercise to I'm going to attempt to move your head. Try to turn your head to the left. I'm sorry. Just direction. Okay. Okay, you can stop. Okay. Try to turn your head to the other side. Okay. Good. Very good. Testing the range of motion for neck, the sternocleidomastoid. I'm going to move on and do the other range of motion exercises for the neck. We'll start with flexion, which is chin to chest. Hyperextension, chin to ceiling or head to ceiling. Back to the normal position. Lateral, ear to shoulder, ear to other shoulder, and rotation. Look around your right shoulder, over your right shoulder, and look over your other shoulder. Any pain when you make any of those motions?
No.
Good.
Okay.
Complete range of motion for the neck. I'll also visualize the neck. You have a bottle of water. Can you grab it? I'm going to, before you do that, I'm going to just identify the cricoid cartilage and the trachea, the top of the trachea, and the body of the part of the thyroid that I can see would be between the two. I'm going to ask you to, I don't see any swelling and visualizing, and I've palpated no tenderness. I'm going to ask you to take a swallow of water, and I'll watch to see no visualization from the side. I'll step to the back in order to palpate. Feeling for the same landmarks, the cricoid process and the trachea, and I'll place my fingers between the two. It's kind of low. Okay, I ask you to swallow again. I ask you to swallow, please swallow. Are you to swallow? Okay, one more time. Sorry. Okay. I don't feel, swallow again. I can't, there's no swelling here, and I didn't feel anything odd on the other places. And I will now, I'm going to palpate your supraventricular lymph nodes here that are located here, but most often, as yours are not palpable down in this angle. I'm looking at your skin overall, as I've done everything, and everything is, the color is good. The thyroid is not visible nor palpable, or no signs of swelling in your neck. Everything seems to be no goiter. Everything seems to be normal and healthy. So that concludes the assessment of HEENT.